So we're going to get going again for the last part of the day with the three key theme from vertical to horizontal: who's driving, who's directing, who's controlling. And at the table, we have Françoise Gaudestès, Dominique Pon, Nicolas Revel, moderator is Antoine Flao. François Dupuis couldn't come here because he's ill today. He's sick in bed. And we hope that he will be back on his feet soon. I'm not going to replace him, but I'm going to take his seat anyway. We're going to run the little video to introduce the theme. The Health Ministry, the government, the General Director for Health, the General DGOs, the General Director for Social Action, National Health, the Regional Health Agencies, National Agency for Assessment of the National Agency for Safety of Medications, the Agency for Biomedicine, the French Blood Center, the High Council for Future, to list but a few. In these healthcare and systems institutions, people work in offices, most often in Paris, drawing up endless bylaws, decrees, directives, regulatory texts, quality reference systems, and recommendation for hospitals and doctors' surgeries. The life of a hospital doctor or GP in their surgery would be too simple if this crazy tower of texts, which are sometimes contradictory, did not require all the crazy checking and monitoring to go with them. This regulatory craze is full of good intention, whose aim is to help healthcare structures to run in the best possible way. But the result is quite the opposite. In this bureaucratic and verticalical system, each pawn ends up ensconced in a straitjacket without anybody really being responsible for the objectives or results. What's the solution? Perhaps it will come from companies who have long understood that the only means of improving the quality of services procured is to switch from a vertical organization to a horizontal and cross-functional model based on projects. All managers know this. Innovation comes from the field. An orderly nurse will also know how to optimize their practices better than somebody working in ministry. Patients have thousands of suggestions about how their demands can be better met, and most of these don't cost a penny more. There's a wealth of ideas out there. We simply need to harness them. When are we going to get hospital directors to do an immersion course in their own hospitals by burying stretchers, washing patients, or instruments? There we have it. Hello, everyone. We're going to try to tackle this topic by talking about Europe and talking about France. Europe, because we have a European deputy with us. And I'm going to make a little detour via Switzerland, which is not the European Union, which is also nevertheless very close. And that's where I work and that's where I live. In fact, there are several of us in Switzerland. We realize we have a very horizontal democracy. We vote on everything. We've just rejected the reform packet on the retirement package. We were called on to vote on the pre-implant diagnostics on complex subjects or simple subjects. We vote on everything. No, we don't want to lay one system onto another. We don't want to apply the horizontal Swiss system on the vertical French system, which has its own history. But on Europe's level of Europe, there are questions that arise because a lot of people are not satisfied with how Europe works. They find it very technocratic and very vertical. The European directives come down on us without ever being discussed by the citizens of Europe. And we say that if we had an open book, like in each of our little cantons in Switzerland, we have small cantons and big ones, but it's not the same as Europe, of course. We don't want to give anybody any lessons, but a model of a more horizontal democracy type, we would be much more often consulted before the directive falls on us. But on the actual future European directives, with all the role of the Parliament, of course, and of course the Parliament in Switzerland is not a model where the one who's directing and driving and controlling would give more room to the citizen. Now, this is very provoking when the little film that we've just seen, we see the different levels, different administrative levels, and we don't talk about Europe. So this is surprising because it's already the biggest error that the French commit is to forget Europe. And yet I would remind you, and everyone who's representing companies and pharmaceutical companies, you all know very well, the legislation, pharmaceutical legislation, it comes from Europe. It's imposed on all union members. And there's been considerable advances. I can give you, there are countless examples, but I can give you one, but just the one on rare illnesses. Without this regulation, we would not have the progress that considerable progress that we've already had and recognize in the domain of rare illnesses. There are lots of examples. When we say that Europe isn't democratic, I'm quite shocked because the European deputy has a purpose in the Parliament. Of course, the European Commission asks the Council to go prepare a proposal for a directive or a regulation. But it's the Parliament that makes the laws with the Council. The Council is who? It's the governments. It's the ministers of health. So there's a representation by European Parliament, a representation that's democratic. I totally oppose that point of view. When we work on a proposal that's made by the European Commission on a directive or on a regulation, a legislative text, well, the Parliament, through amendments, will either modify or improve, either in certain cases, sometimes it's completely the law. The background of the text, the foundation of the text. So there's a real democracy in Europe. And you know, we haven't invented anything European. When I'm reporting on a text, a legislative text that has to do with health, not only do I meet all of the actors in healthcare, but as to say the physicians, the pharmacists, the different associations, I also meet with the representatives of the different governments of the 27 member states. I meet also people from the different associations of patients. And if we've been able to have a regulation on pediatric medicines, which of course needs to be perfected, and we're taking care of that, it's simply because we were so pushed and so driven and poked by association talking about sick children that we imposed after a few years. We made the European Commission give us a proposal. So I cannot let people say that Europe doesn't exist. That's completely false. On the contrary, and I think that all the manufacturers know this, Europe is real, but the European deputies are there in order to exercise this democracy, and often with quite a bit of independence, because we are somewhat removed from Paris. We do not receive direct orders from Paris. We have to work on texts that will apply now in 27 countries. So we have to take everyone into consideration. So Guy, democracy in Europe, is it horizontal? I wouldn't know. In Switzerland, yes. There's all kinds of voting in Switzerland. The smaller the country is, the better, the easier you can do that. So what we're missing is regions. And I'm convinced that, of course, there's democracy. I totally agree that there's democracy in Europe. We've been told all kinds of stories because the media sends all kinds of ridiculous things. But I've spoken to the European Parliament, and I can tell you there's a lot of work that goes. So each European deputy has at least 5 or 6 employees, and these people work crazy hours. They work incessantly. It has nothing to do with a French deputy. I'm sorry to say it, but it's nothing like a French deputy. But that's the way it is. You should see the machine in Brussels. It's a real machine. We say they're outside of everything. It's the width of a toilet pipe. Yes. There are things that are too fine-tuned. But to say that there's no democracy in Europe is an error. It's even a lie. Okay, let's get back down to the nation level. Since everything goes well in Europe, so there's no lack of democracy in the European states. But today we're going to talk who drives, who controls, and who directs. So for the moment, it's very vertical within companies. Is digital technology going to help to contribute to make things more horizontal? We saw that we talked about making things more horizontal within company, which would be the cutting edge of this growing horizontal application of relations between citizens. I think that the company isn't democratic. We don't talk about the director general. We don't talk to him. And so, what's your point of view? Well, it's clear that There is perhaps democracy in Europe, and certainly not within companies. That's the least you could say. If you look at the evolution of the work world and the organization of the work world in the last 30 years, I'm sorry, but that's the way I see it. We have a less paternalistic model, but now we have a model based on industrialization with processes and indicators. But we've never decided to put trust on the individuals. Now people say today that we've forgotten the human. You can imagine if companies said that decided that they realized that they've forgotten people. It's not that we have forgotten. We have methodically annihilated people within work. Just look at the vocabulary within companies. There's no more emotion. There's no more emotional aspect. We never talk about enthusiasm and ideal. We talk about values and motivation. And the person was, for example, in French we use the word manager, even such and such a bad word. Managing comes in an Italian swimming term, which means holding the reins of a horse. I didn't want to keep people when I was a kid. I didn't want to do that and control people like they have reins on. So since the start of the morning, there's a word that I found very struck is the word manisme. Today, when we talk about manism, we're monolithist, we're internationalist. I think that the future is humanism. This philosophy that was born in Europe a few centuries ago said we're going to put humans and human values at the heart of everything. We have to have a digital humanism. We have a management humanism. We have to have health humanism. That's where we're going to be good. And today, we don't have that. We don't have democracy. We don't have the human. We're not even the humanism. I think that's the direction we should take in a deliberate way instead of staying in a kind of staying in the morass where we confuse everything. Nicholas, we're going to look at the health system, but before we do, let's stay in the company for a moment, and let's talk about when you're at the head of a company that has 80,000 employees, like NPS. How can we put humanism? How can we put some horizontal aspect in there? Is it desirable even? How do we put in some humanism? It's not easy to do. It's hard to put in theory. It depends on the behavior and the spirit of minds of the managers and the directors. But I come back to the question of the question that we have at the health insurance, of that question that you asked earlier, between management or vertical steering or coordination on the horizontal level. All major big organizations have this same question. And it also applies to our health system because we see that there's a decisive element in order to make it move. So I'm not very comfortable with the opposition between in the film. Of course, we're in a film that focuses on vertical steering. We're very centralized. We're very regulated. And I'm aware that sometime there has reasonably been that we have to get out of this. We have to breaking thing down and making way for everything that's going to be horizontal nature, coordination of the territories. So in opposition with national steering or national oversight. I'm going to try to defend this. Like I said, that we need this national oversight rather than to have a horizontal application because each person is convinced of their position. But I think it's so that's why we're having some trouble in our country is to articulate both of these aspects because we need both of these aspects. This need to find intersections for linkage between this of a kind of mechanism that links them up is true in big organizations and it's true in our healthcare system.
And then I don't want to take too much time here, but I think our healthcare system today, we can see very well that we're in this paradox that I will caricature a bit, but it's a healthcare system that's under tension and under pressure, and even if it's not an underfinanced healthcare system, that's the paradox. Why? Well, because it's weighed down by real organizational rigidity and imbalances, and everyone can see this between, and there's a lot of partitioning and atomization. We have remuneration methods that maintain this organizational rigidity. And so we're going to need to really, as we say in French, move the lines. We can't have this big bang, organizational big bang with top-down laws. And I don't think that all of these lovely local experiments that are going in every direction are not necessarily a good answer either. Because in France, we have this difficulty that very often experiments are started without being part of a national framework. And then, so there's no assessment, no steering, no supervision, and then no capacity to really derive something that will then be disseminated to improve the system as a whole. So this horizontality and verticality, to conclude on this issue, for me, what's really essential to every healthcare system is to ask the question, how do we work on combining the horizontal and the vertical? And I think in the PLFSS, which is arriving for 2018, we're going to start to find some answers to make some progress in France. Now, let me turn the floor to Guy on this point, because Guy is a fan of horizontality. No, not at all. If we take the example in the healthcare field where horizontality leads us to a disaster, let's take the example of vaccination. Maybe I'll shock people in the room here, but basically, we have a minister who's taken extremely vertical decisions on this topic. We see blogs and social networks and a huge horizontality that is leading us into the wall in terms of vaccination. If we have a huge democratic exchange, we'll have, on the topic of vaccination, we'll only have half of the people in France who are convinced that vaccination is necessary. So horizontality does have limits in certain areas, in particular steering health policies. Yes, you're right. That's an excellent example. It's very striking. Now, to change the structures, François Mitterrand said a revolution can be done with 4 people: the boss, the intellectual, the cop, and the communicator. And the rest, we don't care. And then you have, on the opposite, you have Jack Welch, the CEO of GE, in 1991. He saw internet arriving. And staff was beginning to worry. And he sent an email. He said, destroyyourbusiness.com. He sent this to 300,000 employees. And he sent information to everyone. And then he sent them another email saying, growyourbusiness.com. So now you've understood that we all agree and we can go forward. So I think first you need to start by addressing all the people who do the day-to-day work, to then go from the bottom up. Horizontality doesn't work. We saw that in the Larzac with these hippie communities who went to cultivate some sheep, and then they started to fight each other. Obviously, it's obvious. It's all very nice. It's all very well. Or you have the Soviet verticality, where a nomenclatura manages everything. So I think we have a system that remains very Teutonian since Louis XIV built Versailles. It was to oppose the aristocrats. And we've remained in this situation. It makes me think of a dinosaur. A dinosaur used to be 40 tons with huge feet, and the body was very heavy. How did he move? How did he move around? Well, millions of years, after millions of years, he created a very long tail and then a long, long neck to balance everything and to have less weight in the middle. And then he was less agile, yes, because he couldn't go between the trees, and then maybe he was struck by a meteorite. But we are in a country of the dinosaur type, and I think the best of the reforms in France, and many of you may agree with me, is to modify the structure of the state. And Pisani, I think, proposed a plan of 700 million euros for the civil servants to give their comments and send in their good suggestions. I think that will work, but I'm worried that the elite, the 3,000 elite who control France, it's the court, the courtesans, if you will. Yes, there's the executive power, but it's these courtesans that control France. And he wants to replace the directors of these large corporations, and I think he's right. But I think you're going to have to take an ice axe and start to break down the structure of the state and then say 25% should be the state and 75% should be controlled by the regions. What about Europe as an MP? Well, we often come to knock on the doors of Europe when we have people always come to ask Europe for money when they have projects to finance. So it's all very well to be anti-European, but as soon as people need some euros, they always think about Europe. I see everybody coming to my office. How many companies, startups, have come to see me regularly in my office as a European MP? And in the healthcare sector, there are many things being done in the region, in my region. They come to see me and they say, do you think I could benefit from some Horizon 2020 research program funds, which is a huge program? They systematically come to ask me for a certain number of things from Europe. So yes, there are European finances, and I would like people to consider Europe as not just a money distributor, because that's what has led sometimes to Euroscepticism. But so who is driving, who is leading, and who is controlling? And the verticality and yes, we still need some verticality. We need decision makers. We need people who give orders, who are responsible, because if we no longer have this flexibility, if we want some flexibility in the system, if we want to encourage innovation, we do need more flexibility, but in that case we need more responsibility. So people giving the orders will be responsible, but the responsibility should be as close as possible to the decision making. So it's true that the regional level is important, but horizontality also has all of these drawbacks. It's being developed. Why? Because of the arrival of digital technology. This means that each person has the impression that they can be an actor in healthcare, including the patient. And that's extremely dangerous, moreover, because this can lead to a lot of confusion and disinformation. And a lot of doctors say that they have patients now who come to their office and who think they need to teach the doctor how to diagnose because they've seen such and such information on the web and it hasn't been controlled. So it's true that horizontality is necessary at a certain level, but I think we need to keep some verticality. That's absolutely essential. Well, when I'm listening to you, I'm not sure whether things are changing much. So you've said we need to maintain some verticality, not go towards too much horizontality because it's dangerous. And yet, what role will digital play? Dr. Watson may add more horizontality. I don't know. Of course it's complicated. Of course there's no real solution. But the thing that we absolutely have to avoid is do what we usually do in the healthcare sector, which is copy 15 years late the models that are already molding from industry. That's what we're doing. These are outdated things that we're trying to copy. I'm worried about this. You have to look in the field at the despair of some of these orderlies and people and nurses in the field who have to deal with these dehumanized processes that they feel they're being crushed by. Human beings are caring for other human beings in the healthcare sector. If we don't invent a model that mixes horizontality and verticality with a human logic, who's going to do it? I think in our sector we have the capacity, we have the intelligence, we have the resources, we have the people in the field, we have the intellectuals, we have the institutions that will allow us to invent a model, but a French model that would be slightly innovative, that's not trying to copy models that are already obsolete in the industrial sector. I have a proposal. Why don't we try in the healthcare sector to replace the word managed by the word love and the word management with the word love, and we'll see what happens. There's Lacan defined loving by giving something that you don't have to someone who doesn't want it. That's a psychiatrist. But all of a sudden, I realized that it's the same thing with managing. Managing is giving things that you don't have to people who don't want it. So managing and loving is the same thing. But this would change a lot. You see the organization charts in companies. You could use the word love, the Council of Love instead of the Board of Directors. You could change a lot of words. But obviously, this is a joke. But loving people, caring for people, let's trust these people in the field. I don't hate the French social security system. On the contrary, I think there are many things we can do with these people. I think, and please don't dehumanize our system. I'm sure we can create innovation by placing our values, our own values, back in the systems, the organizations, and the innovation. We shouldn't try to move away from that. Nicolas, well, let me tell a story. We asked Dominique to come to the General Assembly in Toulouse from this French Social Security Authority, and there were 1,000 people, and they all applauded him. And of course, obviously, the director didn't find it very funny, and that's a bit of an exaggeration. Because, no, I'd like to react to what Guy said about the fact that the state should perhaps carry out its own cultural revolution. As usual, I agree with the last part of your sentence, but should the state withdraw and become smaller and then entrust more responsibility to the regions? I'm not sure. I think there's a huge ambivalency on everybody's part on this subject when we say we're really tired of verticality. What I know in my discussions with professionals, healthcare professionals with whom I work, is that everybody wants a framework. People want a framework. People are attached to rules. And when one of these social security agencies apply a rule differently from their neighbors, it creates a huge political psychodrama, including when they've gone to discuss this with local counterparts to find a way to apply it. So this creates issues. And I'm not convinced at all that in France, in terms of the remuneration methods, which I think is a decisive element to really change the organization of the system of coverage, healthcare coverage, I don't think that in the future French people and French healthcare professionals are ready to have a different price in one region and another for hospital care, or in Montpellier and Strasbourg. I really don't believe that the French will accept that. However, what I do believe, and here I agree with Guy, is that if you think we're going to deploy innovation from the top down, we can see that that is never successful. When you try also to experiment with an idea that comes from the top, usually it has to be passed in a law. In France, we are a country that truly believes in the rule of law, and any experiment has to be transposed into a law. And that when it starts, it's 3 years later, and sometimes the issue is already outdated because life has changed things. So I really think we need to revise this approach. Innovation has to be from the bottom up. And we must innovate in the sense where innovation can be an exemption from the rules, financial rules, pricing rules, and maybe other organizational rules, of course, in a very strict framework. But I think we need to organize this. This can be organized, these experiments, with an objective, which for me is a key element. This is why we need to connect it with national steering. We need to really examine what works. When something works, we need to finally be capable of deploying it. That is our problem in France. Unfortunately, we always come up against these obstacles. I agree with you, but there are initiatives that exist that you don't hear about. In Charleville-Mézières, the private practice doctors are actually in the hospital. They've closed their clinic and they've gone back to the hospital. In Châlons-en-Champagne, they're building again with the hospital. You never hear about this, private and public doctors coming together like this. It's too bad. There are many things happening in France. And when it comes back to the techno-structure says, oh, that's great what you're doing, but it's not reproducible. That's a terrifying word to hear. We can't model it. We don't care. We won't do the same thing in Brest, Strasbourg, Lille, and Marseille. Why don't we let local initiatives emerge? The cultures aren't the same. The pathologies are not the same. Can they just let us do it? Leave us alone. Let us do it. Control us afterwards. In France, the citizen is he's considered by the elite in Versailles as an ignoramus, and he has to be told what to do. You can't even teach him. And he's also considered to be a cheating ignoramus who has to be controlled afterwards to make sure he doesn't do stupid things. And that's absolutely something that I can't stand. And that's why many people are revolting against it. So why don't we say, here's here's the North Star that we're aiming at. In 4 or 5 or 6 years from now, this is where we're aiming, and then control it. There would be many initiatives. People would be delighted, and we would all love each other, and we'd all be hugging each other, just like you said. There'd be even more love. Now, at one of the round tables earlier, my neighbor was sitting next to me, and he said, if the pharmaceutical project is working, or that the person's pharmaceutical record is working well, it's because it was a bottom-up approach, and the patient's medical record is a top-down approach. Is that correct? Is that why it's not working? Well, the DP is supported by the National Order of Pharmacists. It wasn't just born from the bottom up with a few pharmacists who said, let's just create this. No. Obviously, the DMP, the electronic medical record, I won't do an autopsy on it since 2014, but I was very lucky, or maybe unlucky, that the social security system, we actually recovered the responsibility for this. We were since January 2016. And I hope now that we will succeed in creating something with this new medical record. I'm doing it very humbly, with a lot of modesty, and working a lot with the actors around me. And Dominique is one of the people that we work with in Toulouse in our pilot phase. And it's interesting. I have a strong conviction. Yes, we need this electronic medical record. And we need national impetus. And, for example, a person could actually open their electronic medical online. Well, I think it would be useful to have the Social Security Authority support this, so that the patient could then have their DMP on their smartphone or their EMR. Today, there are 9 French départements or counties where we have pilot projects with the EMR, and so they have the possibility to download an application on Google Play Store, and they can consult their medical record. And then how is this medical record going to continue as a system? It shouldn't be isolated. It should be able to be enriched. It should be able to dialogue with thousands of other healthcare databases through applications which must be able to dialogue together and enrich each other mutually. We'll have, obviously, questions of privacy, but this is how we will succeed. I am convinced that that opposing these two logics, top-down, bottom-up, is pointless. The crux of the matter, the most fascinating thing, is to try and find the point of junction. Dominique, what about citizens in the experiments that you're carrying out? Are you involved in the electronic medical record experimentation? Yes, we have to be involved. But to come back to what Nicolas said, we really want to help him, the poor guy. I mean, really, frankly, we want to help him. I don't want it to be a failure as a citizen, as a taxpayer. We've been hearing about this DMP, this electronic medical record, since 2004. Now we really have to mobilize to help the social security system. And I think the national team is really attentive. They're really open. So we need to help them. So vertical and horizontal, I think we need to have. I think we need to love our social security system in France. Well, have they forgotten Europe, do you think? Well, when you talk about healthcare policy, obviously there is a national competency when you look at the management of the French social security or healthcare system, and Europe is at another level. But I'm convinced that gradually we are developing a Europe of healthcare, because obviously borders don't exist to treat many of our problems. When you look at vaccination and the decision of our new health minister, I think it's a perfect decision, and I emphasized this when the decision was published, because I myself am constantly calling upon healthcare professionals in France to do their job in the field of vaccination, and we're going to launch a program, a European communication program, to encourage the member states to focus more on vaccination, because it is a problem that concerns all Europeans. But there are many other topics. When we worked on the new transporter healthcare directive, it was an extraordinary tool to serve patients, but it was difficult. There are so many points that haven't been worked out yet and that aren't positive. We have our
European networks, our reference networks, and they work well in terms of points of contact. We've had difficulties in France in this field, but we're moving ahead. We've got the free circulation of people within the European Union, and obviously in the healthcare field, each European citizen needs to be able to say, okay, I'm going to find care where the quality of care is best, given what I have. So that is the European scale. Now, of course, when there are affairs like mediator or the PIP implants, what happened was we were already revising legislation in these fields. But those examples came to back up the fact that at European level, we had to strengthen legislation in order to take into account what had happened, unfortunately. We saw the gaps, and we knew we had to improve things. So the European level is essential. Guy, I'd just like your opinion. So I'd like to come back to the subject of this panel discussion, the integration of what's vertical, what's horizontal. So there's a very high cost from a horizontal point of view. Somebody this morning was saying we've got to get rid of meetings. So if you're vertical, you don't need a meeting or very few meetings. You can get rid of all of the meetings and have immediate verticalization. So there's a contradiction between getting rid of meetings and clinics almost made that a model. But in fact, the meeting is a very important point for horizontal management. What do you think about this? Don't you think? So if you agree to horizontality, if you want us to move towards horizontality, it has to go slower. I think we have to have a mix. I'm not promoting horizontality. If we take the shared medical file, Douce de Blazier in 2004, he said we'll gain 2 million or maybe 5 million euros or however, or 30. Who says, right? Anyway, 13 years later, here we are. Nicolas has just said there are 9 départements, 9 administrative areas trying out this shared file. They've done everything privately. And I went to see him. I went to see the guy behind it in the dispensing chemist. So we can be blocked. Why didn't we do that? Why didn't we do that? No, it's a dispensing chemist. No, it's with the Association of Pharmacists. It was a group of pharmacists who talked together. Why didn't we use that as a basis in order to add the medical data? Again, we built something, a Babel's Tower, with too many people. Communication between hospitals requires a mobile. Each professional should have a mobile. 600, 700 telephones. If you have a kid arriving with appendicitis, you tell the parents appendectomy. That's where it starts. It doesn't cost anything. The cost of a secretary in an office, we're not even able to do that. So we've got all of the tools we need, all of these digital tools, telematics, so that we don't have to get together all the time. But sometimes you need to be present. But once you've worked on the subject, I'm repeating myself. We're still in this stationary system. And I think we have to create a revolution. We need to do it progressively, but we need to strip things down. You know that a hospital director has 230 decrees a day with thousands of pages. We should stop saying that they can be fired after a few years. It's terrible. I think that we're an old country, and if we don't change that, we'll be heading into deep waters. Let me be optimistic now after all of this. Let's talk about the initiative for participatory democracy and horizontality. Let's talk about that. Some of the clinics in France, so independent clinics, a rare species today where there are physical people, we've decided to try working as a cooperative, so real participatory democracy, collective intelligence working together. So we created that in 2012, and there were about 10 of us to begin with. Now there are 140 of us, and the dynamic movement has been created. We work on shared projects, we exchange experience and information. We've just created a GCS for clinical research. We're working in order to pool purchasing. There's no boss, there's no verticality, and yet we are subject to harassment. But we are managing it. No, it's not easy every day. No, we learn on the way. But at the same time, we don't want to have this logic where people are passing the buck. If we trust the people involved, there are many new models that can emerge positively. Efficient models, innovative models, and human models. Nicolas, you have the hot potato now of the electronic medical record. Well, 9 départements were concerned. Hopefully others will follow next year, and you will see what happens. I think it's something that can work. It must work. Now, of course, I don't want to do any role play. Guy says we've got to unsettle everything. I think the framework is important, and I think that it's important to change the way we organize governance. It's true for public facilities. I agree. It's also true of the private sector and professionals. And the professional sector. This attachment to national regulations concerns federations, professional unions. So I think that collectively, together, we need to learn to gradually change the paradigm. And I think, well, I hope we'll listen to the minister tomorrow when she speaks. Let's hope that we will be able to get things to move over the next few years. Anyway, that's my wish. Françoise. Yes, I think I'm the only politician here around the table. We've also got to take on the responsibility of these policies. And if things reach a stalemate, it's because there are politicians out there. How many MPs and mayors do we see with their flags in their municipalities, making sure that hospitals don't close or the maternity ward doesn't close? They all want things for their own areas, for their own cities. Now, to have a healthcare system that offers quality and performance, that promotes equality for all, it's essential to organize the closing of facilities that are no longer ensure that quality and that level of safety. And so politicians often play the wrong role. I feel it's terrible when I see my colleagues demonstrating. I know that that's not what should be done. Now, you have to have courage to say to your voters in your area or city, yes, I agree for the facility to be closed because there's not enough work and it's not offering the right performance, even dangerous for you and your health. It would be better to go 30, 40 kilometers away and benefit from a healthcare facility of quality. It's complicated, but politicians often play a very negative role, and I'm sad about this. Unfortunately, the responsibility is a shared responsibility. But in the last minutes that we have left, let's bring up a point. There are two teachers around this table. If we talk about the human aspect and humanism in relations, notably in the healthcare system, we need to have a trained citizen. We need to have trained professionals. How do we go about this, and how do we use this digital revolution to help us with this training? There are initiatives being taken. There are MOOCs, massive open online courses. Do you think that this will be a key challenge with this horizontalization? Yes, there are simulation systems that are essential if you want to learn the right kind of gestures. This is what pilots do. This is normal. No patients will be operated on by people without experience. This is what we do in surgery schools. Now, I was thrown out of where I was because I thought it was a terrible thing to send out inexperienced people into the real world. Now, our medicine studies no longer correspond to what is out there, to what is needed, where out of time we are learning things that are useless when it comes to psychology. People don't even know what the organization chart is, and then they're sent out into the real world. So we have to review everything, just like we have to do this for education. I think we're very much behind. We're in this very old medical tradition. We need to reduce medical studies to 8 years. It's 12 years. It's too long. With what Nicolas was saying as well, the profession itself needs to change. The teachers need to change. Yes, of course. I like Jean-Paul Horty, but the union was created in 1968 to resist. Today it's 2017. So that's many years of resistance. That's good, Jean-Paul. But there we go. But that's what it's all about. We can see how former private practice doctors work. The young people are lost. They're going to be useful for people. Leave your private practice. Now, we need to help with this. They're very useful for young people. And they should stop saying, OK, I do it best, and this is what I do, and I go where I want when I want. What about this mixed culture? You're an engineer, you're an IT engineer. What do you think? Well, what I think is that the first people informed are the decision makers. It's like the Davos of health. How do we organize the healthcare system? And then there are the people from the field. The first people informed should be the managers, and the best training is not digital. The training of the manager involves going to wipe patients' bottoms, to peel potatoes, to clean. Humility, the humility of managers is essential. Well, who is a manager? It's somebody who says, OK, I think I have the right kind of intellectual capacity for people to give the best of themselves. No, if they reason like that, they must have a problem. They must have a problem, their difficult relationship with their mother or father. There's something wrong, sexually perhaps. So if the manager realizes this and is humble enough to say that their training is going to be in the field, thanks to the people that he or she works with, that's great, that's fantastic. In hospitals, in clinics, in private practices, that's what training is all about. And digital technology will accompany that, will help with that. And this will be humanistic. We shouldn't invent disembodied things. We want great things in the future. But let's come to the basis. Let's get back to the roots. There are huge resources out there. There are many things that can be done. Recognition and trust. Recognition of personnel. We need to ask their opinion. They will tell you many things about their job. Productivity goes up straight away as soon as you ask them their opinion. It's true everywhere, not just in the healthcare sector. I think that in all companies it's the same thing. In all offices it's the same thing. Digital technology offers us tools so that we can save time. It helps us with decision making, makes decisions faster and efficient, but it's just a tool. You've got to put the human being in all of that. And that's a very positive aspect. Nicolas, no, I remain very humble in front of this question. I've never actually swept the corridors. Having said that, I am convinced that it's thanks to the men and women in our facilities that we can create a state of mind, and things can go very fast and change very fast. Now, I'm not sure that there's a magic wand that will allow us to train everybody, transform the psychology and the mindset of everybody in one go. If you're convinced that you're a great manager, well, I think it's not right. You should be humble. Conclusion? No, I think everything's been said already. And I'm just repeating. It's trust in the men and women who work in the facilities, whatever their level. That's something that allows us to have structures that needs to have a kind of agile, flexible approach. So we're very romantic in France. We need to assume that. So we need to trust people. Let's shoulder that. There can be different things that can be experimented on. You can create incubators, startups. It's really easy. You don't have to be a pressure cooker. With some common sense, you can be innovative in the healthcare sector, but you've got to have an idea, and there are no huge projects. And we need to transform the way we think. So it's not just a question of opening the door and window for people to come in. And I'm surprised to see that year on year we have more and more teams, more and more projects that are born, and people are very happy. Thank you.